The United Nations Population Fund, in collaboration with the Federal Ministry of Health, gathered to deliberate on how to provide quick emergency plan on sexual and reproductive health for internally displaced persons, especially in the northern East Nigeria. The Minimum Initial Service Package by the Unfpa and the Federal Ministry of Health is being implemented to identify gaps and provide access to quick emergency response, especially to pregnant women and girls, to ensure that they receive interventions where need be within the shortest period of time. The workshop is centered to provide assessment validation, as this validation will be worked upon by both government and other stakeholders in the health sector for a better Nigeria.
Readiness assessment, otherwise referred to as the Misp readiness assessment, aimed at putting in place a kind of contingency plan for sexual and reproductive health in the event that an emergency arises in Nigeria, in any parts of the country. Right now, the Minimum Initial Service Package, MISP, is being implemented in northeast Nigeria, which presently is experiencing the humanitarian crisis in a protracted form, and now on the mode of moving to recovery, which the United Nations and other humanitarian partners, as well as the government of Nigeria, are actively spearheading in order to ensure that lives are restored adequately. So the Means Readiness Assessment aims at identifying any gaps in implementing the MISP such that it can be addressed, and then if disaster strikes in any part of the country, it won't be a difficult thing to act within 48 hours to be able to ensure that pregnant women deliver safely, and also other sexual and reproductive health risks are addressed within the people that may be displaced.
You know, the humanitarian response has started for some time, but you need all stakeholders, whether government, non-government, private, and all partners to be on the same page. You know, when we're all on the same page and we understand what the issues are in being prepared for emergencies, what our individual roles are, and that, you know, we're also working collectively to achieve a common goal. We are working based on our strengths to achieve a common goal, so that in terms of sexual and reproductive health in humanitarian settings, we make sure that the whole package is available, and that we do it, of course, through a bottom-up approach, going through the primary health care centers, right on to secondary and tertiary, but also, you know, taking into account the people who are in charge of all these areas, you know, the Federal Ministry of Health, the National Primary Health Care Development Agency, the Ministry of Humanitarian Affairs, MPCD, all the various key players. We all need to work together, because we want to make sure that, apart from, you know, the normal situations, we don't want maternal mortality to continue to increase. We want it to decrease, but we also want to be prepared to make sure that, you know, we have less of this even in crisis settings, you know, by working jointly together, making sure that all the package of services are available, and that we can meet people at the point of their needs.
Talking about sexual and reproductive health agencies, is the government...
As a ministry is always a policy guidance, is a policy formulation, and of course to provide oversight to the agency, especially the primary health care services that is providing the minimum service, supposed to implement the minimum initial service package for the SRH assessment. So currently, the Yobe State Minister of Health, through the Director of Public Health Services, I think is at the top of the situation, because we have already drafted our annual operational plan for this year. And part of our annual operational plan, we have already also accommodated the sexual and reproductive health services, but which is mainly implemented through the Director of Community and Family Health Services in Primary Health Care Services, Primary Health Care Management Board, under the coordination of the reproductive health coordinator of the state. And also under this the annual operational plan is already known as part of our strategy development plan of the state. And then the Minister of Health is pushing as much as possible to the state government to ensure we fear the advocacy. We also sensitize the civil state government to know the importance of the sexual reproductive health services and in order to release the funds, while the other partners are supporting to complement the effort of the Yobe state government.
We need these things in place. Like, for example, when there is flooding, people are displaced. And because people are displaced, social amenities are not there. They will not have places, no shelter, no food, no clothing. So now we need things in place, and then no healthcare. Because there's going to be cholera, there's going to be measles outbreak, there's going to be malaria because of the mosquitoes. Now you need to put things in place so that in case there is any flooding, what does the state or the national or the local government do at that particular point to arrest situations from happening? Like in Cross River State this year, we had cholera in 2 of the LGAs. And immediately, UN, WHO, UNICEF, and the state, they were in those 2 villages, ensuring that now there was supply of food, drugs, and every other thing to make sure that the number of persons that had died, there was no more deaths. So that they just halted the death and then ensured that every other person was taken care of and everything ended. Now, in
Unfpa have been collaborating with the Anambra State Ministry of Health and Anambra State as a whole, not just the Ministry of Health, the Ministry of Women Affairs in Anambra State, and they have been supporting us both in delivery kits, in the contraceptives. We've been having the kits they've been bringing into the state. They've also been supporting the National Association of Midwives in Anambra State in some kits during their programs. So we have a lot of support, and we're anticipating that they bring in more and they help the states in the fights against the flood that we have in the state. Incidentally, our First Lady, the First Lady of Anambra State, Dr. Nonye Soludo, is passionate about these flood-affected victims. So it's a good thing that they are collaborating with us, and we expect them to make more impacts in the health sector in the state.